So we're gonna look today, or the session today is about the overview of the trigeminal nerve and the ophthalmic division. So the first division of the trigeminal nerve. We will begin with an introduction. So the trigeminal nerve is, as you know, a mixed cranial nerve. It has sensory but also motor component. It's one of the largest nerves, or one of the largest cranial nerves. And this one is the main sensory nerve for the head, but it also supplies muscles of the mastication. So this one is responsible for the general somatic sensation of the head region, but also innervated muscles of the mastication. So it's related to the movements of the TMJ. It is called trigeminal nerve because it has three divisions. So the main three branches are these ones here. This one in green is the ophthalmic division. This orange one, maxillary division, and this one here is the mandibular division. So remember that, as we have said before, this one is a mixed cranial nerve, and that means that it carries sensory but also motor component. All the three divisions carry sensory information, but only the mandibular division carry a motor component. So we have the general sensation here of the dermatomes of the face, and it will give us this pattern. So if we look at the different sections of the dermatomes here, this one here belongs to the ophthalmic division. So it will be the forehead, the eyes, the superior eyelid, the dorsum of the nose, and then we have the maxillary nerve in here that will supply the infraorbital region, the nostrils, cheeks, lower eyelid, and also the upper lip, and a bit of the temporal region there. And finally the mandibular division, this one here in yellow. This one will supply the rest of the face, including the mandible, the temporal region, the region anterior to the ear. And it's important to notice here that the angle of the mandible is not innervated by the trigeminal nerve. It is supplied by branches of the cervical plexus. So in general, they all carry sensory modalities, and they will all supply the mucosa that surrounds the nasal cavity, here the oral cavity, the paranasal air sinuses, and also parts of dura mater. From this one, so try to remember that the superior eyelid belongs to the ophthalmic division, inferior one from the maxillary, but also the superior lip, and the mandibular division will supply the inferior lip or lower lip. So yeah, will supply skin of the face, but also intracranial structures, and some of these cavities, but we cannot see, these ones here, some of these ones as well, and these ones. So those are the paranasal air sinuses that we saw before, are also innervated by the trigeminal nerve. And as we said, only the mandibular division is the one that will carry a motor component. So it will supply all the mesoderm structures that are associated to the first pharyngeal arch. So this will include the muscles of the mastication, so temporalis, masseter, medial and lateral pterygoids, but also the anterior belly of the digastric, the tensor veli palatini, and the tensor tympani muscle. Here you have a diagram of muscles, some muscles of the mastication, so temporalis, masseter here. This is the anterior belly of the digastric, so remember that this one is innervated by trigeminal, but the posterior belly is innervated by the facial nerve. And here we have medial and lateral pterygoids. Now, looking at the nuclei of the trigeminal nerve, so we are mainly talking about afferent fibers in here. So these fibers are traveling from the periphery towards the nuclei, and in this one, motor or efferent fibers are traveling in the opposite direction. So from the cortex, we have the cell body of the upper motor neuron, and then it will synapse here with the cell body of the lower motor neuron that is located in this nucleus, or this nuclei, sorry. So yeah, we will talk about where the different nuclei are located in the brainstem, but first we need to know what is the definition of a nucleus. So you know that a nucleus will be gray matter. So therefore, as it is gray matter, we know that this will be a collection of cell bodies. Now, we can have gray matter in the central nervous system or in the peripheral nervous system. In the central nervous system, a collection of cell bodies is called a nucleus. But in the peripheral nervous system, a collection of cell bodies will be known as a ganglion. Okay, so in this case, because we're in the brainstem, these are collections of cell bodies in the central nervous system, so all of them are gray matter in the central nervous system. What else? So yeah, we have three main nucleus. This diagram here, it's a coronal section, and looked from a posterior view of the brainstem. So we have in here the superior colliculi, the inferior colliculi that are located in the midbrain, and then a bit more inferiorly at this level we have the pons anteriorly, and posteriorly we will have the cerebellum. So in here we are located in the fourth ventricle, and then inferiorly we have here the medulla. So this one here, this diagram is showing us the three main subdivisions of the sensory nucleus of the trigeminal nerve. So this one is extremely long, and they have subdivided it into three main regions. The most superior one, it's called the mesencephalic nucleus. Then this one here in the middle is the chief sensory nucleus, and inferiorly we have the spinal nucleus. This one will extend into like the spinal cord, almost like the spinal cord. So important about this diagram, I think at the beginning it's a bit difficult to understand, but try to follow like the information that they are carrying. So for example, this one here has the receptors in here, and this one will perceive the proprioception. The axons will enter here and will synapse at this nucleus. And so this one, the mesencephalic nucleus, is related to proprioception. Then we have touch and temperature. This one has the cell bodies located in the trigeminal ganglion. So yeah, then this one, do you remember about the ascending fibers? Because we had a session for revision of ascending and descending tracts a couple of weeks ago. And do you remember the dorsal root ganglion in the spinal cord? Yeah? So that has cell bodies of the first order neuron. So the cell bodies will be located in the dorsal root ganglion, and then they will enter to the spinal cord. So this is the same as the dorsal root ganglion, but in this case our first order neuron will be this one here. So the cell bodies will be located in the trigeminal ganglion, which is making the same as the dorsal root ganglion. And then they will enter here to the brainstem, to the nucleus in this case. Why is it called a nucleus again? Because it has cell bodies. So what do we find here? Collection of cell bodies that belong to the second order neuron. That makes sense? Yeah, because as they are sensory pathways, we have three neurons in this case. So ascending or sensory use three order neurons. So here we have the cell bodies of the second order neuron, and the last one, pain and temperature. This one as well has the cell bodies here in the trigeminal ganglion, and this first order neuron will enter to the spinal nucleus of the trigeminal nerve and synapse with the cell bodies located in this nucleus, which belong to the second order neuron. Yeah? So remember that these three different types of information is going to different regions of this nucleus. Now, another important thing is that the trigeminal ganglion will be located. This is the trigeminal ganglion. So this, you will hear the name of trigeminal ganglion, or also could be semilunar ganglion. The location of the trigeminal ganglion in the skull will be in the middle cranial fossa, in a depression that is called the Meckel's cave or the trigeminal's cave. So it's just an indentation where the trigeminal ganglion is located. And here you can see the ganglion where it is located. The main fibers are related to sensory information, and the other root has or is the motor root. When you need to identify, because I know that in the prospectorium we have a cadaveric dissection of the brain where you need to identify the different cranial nerves. So this is what you need to, how to identify the cranial nerves in there. Look where they are coming from or where they should be located. So for example, I know these two are easy to identify. Then just in the midbrain, you will find medially oculomotor, and then laterally in the pons you have trochlear. But the trochlear is usually ripped off because it's very, very thin. Then mid-pons level is where we have the origin of cranial nerve number 5. 6 will be located here between the pons and the medulla, so it's called pontomedullary junction. So medially you have 6, and then 7 and 8 will be located in the pontomedullary junction but laterally. This is the medulla. So we know that in the medulla we have structures in the midline, and they are known as the pyramids, and then a bit more laterally we have the olives. So they are known as olives because they look like olives here. And so lateral to the olives you will have the origin of 9, 10, 11, and then between the olives and the pyramids you will have 12. So that is how to identify them. If you know where they should emerge from, it's easier to locate them in the prospectorium. So yeah, we have talked about the roots, but yeah, remember that this large one, same as you can see here, this one is the sensory root. The smaller one is the motor root of the trigeminal nerves. They are different because they come from different embryological origin. So the motor root comes from the neural cord, and the sensory root from the neural crest cells. Yeah. Right, so the trigeminal nerve will carry only sensory and motor fibers. But there are other fibers that will be hitchhiking this nerve and will be traveling alongside this nerve to reach the target organ. So remember that the trigeminal nerve is a landmark for the organization of the sympathetic efferents to the head region. So the sympathetic efferent are coming from the sympathetic chain, and this autonomic nervous system use only preganglionic and postganglionic neurons. So the preganglionic neurons of the sympathetic nervous system are located only between T1 and L2 spinal cord levels in a region that is called lateral horn of the spinal cord. The postganglionic cell bodies are located in the sympathetic chain. But you know that we have, for example, we do sweat in the face. So that is located much more superior than the sympathetic chain. So in order to reach these regions, the sympathetic nervous system will use, for example here, the internal carotid artery. But also from the cervical ganglion we have fibers that are traveling alongside the trigeminal nerve. So it could be either internal carotid artery or the trigeminal nerve. So if there is damage to the trigeminal nerve, we might also have disturbances of the sympathetic nervous system. Just as a reminder, none of these autonomic fibers then are originated from the trigeminal nerve. So cranial nerves could be either sensory, motor, or mixed. And some of them will carry parasympathetic component as well. 3, 7, 9, and 10 only. None of the cranial nerves are sympathetic or carry parasympathetic component. Okay? What else? Right. So, in terms of the clinical relevance of the trigeminal nerve, so we have talked about the sympathetic fibers that will hitchhike along the carotid system and branches of the trigeminal nerve. So two of the major clinical conditions that may arise from damage of the sympathetic fibers are the Horner's syndrome and also the Harlequin's syndrome. They are quite similar in the presentation that they have, and both are result of sympathetic damage in the head and neck region. The characteristics of the Horner syndrome are focused on the eyelids, and in the Harlequin syndrome we have one side of the face that has failure to sweat and also an inflammation, so you will find like redness in one side of the face as a result of increased blood pressure in this region. So you can see that in the right side of the face. So the Horner's syndrome, we will find that in this patient there is partial ptosis of the upper eyelid. There is also a fixed constricted pupil. If we know that, which of these sides do you think is the affected? The left side of the patient or the right side of the patient? What do you guys think? Which one has ptosis of the upper eyelid? Come on, you have 50% chance to be right or wrong. The left, yeah, thank you. So the left side is the one that is affected. This one also has the constricted pupil. And finally, they also have a facial anhidrosis, so they do not sweat here. So if you think about the function of the sympathetic nervous system, it has roles in dilating the pupil. So if you are in a situation of stress, for example, someone is chasing you, one of the things that the sympathetic nervous system do is that it dilates the pupils, so the visual field is like enlarged, so we can see more things. So if that is affected, then the pupil will be constricted. There is only partial ptosis of the eyelid. Anyone knows why it's partial and not complete ptosis of the upper eyelid. No? So do you remember the levator palpebrae superioris muscle? That one is innervated by which cranial nerve? Yeah, oculomotor. So that is why it's partial ptosis and not full ptosis of the upper eyelid. Yeah, so this is an schematic drawing that will show the root of the sympathetic fibers. So the preganglionic neurons are coming from the spinal cord T1, L2 levels only, and they will arrive to this ganglion. So this is peripheral nervous system. And if this is a ganglion, this is the superior cervical ganglion. If this is a ganglion, then we have here the collection of cell bodies. And they will belong to the postganglionic neurons. So in this case, they will hitchhike the carotid system and will innervate the dilator pupillae muscle. So that's how it works. Now, the Harlequin syndrome has a similar presentation, but the pupil of the eye is not dilated, or not affected, sorry. There is a lack of sweating as well, and the most characteristic symptom is the vasodilation of the half of the face that will produce this inflammation and also redness. So these lesions, potentially in the neck, are located at the level of T1 vertebral levels and will present as either Harlequin syndrome or Horner syndrome. Now we have another condition that in your clinical practice you may encounter to this one, and this is also associated with the trigeminal nerve. Is known as trigeminal neuralgia. So this one is basically pain, because algia means pain, and neur is related to the nerve. So it could be either pain in one or more divisions of the trigeminal nerve, usually affects V2 and V3. So will be these regions of the face. It presents as a really severe excruciating pain. So to distinguish this one from other types of facial pain, we can map the regions where the trigeminal nerve is running through. This condition is a very debilitating condition, because patients feel pain in the face, but obviously they cannot relate it to anything. So it's a chronic pain that will be in this region. So yeah, it's a very, very not annoying, but frustrating to the patients. Now, this one is another condition that will affect the trigeminal nerve, and this one is related to the herpes zoster. So here there is a reactivation of the herpes virus that will cause the chickenpox. So it tends to happen and be more severe if you get it as an adult. They can affect any sensory nerve, causing a band there of rash that will follow a dermatome. For example, in this case, And it usually happens in a thoracic dermatome or in B1 dermatome, as you can see there. It causes a severe rash, blistering, but also ulceration of the specific areas that will be innervated by, in this case, B1. So you can see that it's affecting the forehead, upper eyelid, the dorsum of the nose there. So yeah, the dermatome of B1 in this one. In severe cases, it can be risk, like it can have a risk of sight, and patients can also get it with B2 and B3, and if they do it, it's also uncomfortable because it will affect the mucosa as well. So oral mucosa, nasal mucosa could be affected. Now, the ophthalmic division of the trigeminal nerve. So, just as a recap, this nerve is purely sensory. It innervates part of the skin. So, will be scalp, forehead, upper eyelids, the dorsum of the nose, and also gives sensory afferent to the eye, so the cornea, conjunctiva, lacrimal glands on the lateral side, and the lacrimal apparatus on the medial side. So any functional deficit of this division will cause a loss of sensation. But we do have fibers that will hitchhike this nerve, autonomic fibers, so we need to know about them. So what is the course of the ophthalmic branch of the trigeminal nerve? This one will arise from the sensory root of the trigeminal ganglion, and then it goes anteriorly in the lateral wall of the cavernous sinus. So let's put this into context. In here we have the cavernous sinus. So this diagram is showing us a coronal section of the cavernous sinus, pituitary gland here, that superiorly will be the optic chiasm. Lateral to the pituitary gland we have the cavernous sinuses. So this is dura mater, all surrounding the cavernous sinus. And yeah, within the cavernous sinus we will have main cranial nerves, usually the ones that go to the eye. So it will be 3, 4, 6, and B1. But also we have B2 running here. So in the lateral wall of the cavernous sinus, remember that we have 3, 4, B1 and B2, and then in the middle wall, or running medially, within the cavernous sinus we have 6 cranial nerve and the internal carotid artery. Remember that this happens in the left side and also in the right side. So it's like at this level. So yeah, it will run through the cavernous sinus in the lateral wall, just lateral. The B1 will run just lateral to the abducens nerve, and this is just before it enters. Sorry, this one enters in the orbit, and will give this tentorial nerve that will go posteriorly to innervate part of the dura mater. So just before it gets in the orbit, it will give the tentorial branch. So then the ophthalmic division will be split into 3 branches just before it enters the superior orbital fissure. So here we have a view of the superior orbital fissure, and this is the tendinous ring where we can see the extraocular muscles of the eye. So the branches of the 3 branches of the ophthalmic nerve that will be given before it enters the superior orbital fissure are frontal nerve, nasociliary, and the lacrimal nerve. Yeah. Remember that through the superior orbital fissure we have going through all the branches of V1 and the things that will, not the things, the structures that will go to the eye. So cranial nerve number 3, 4, and 6. Yeah, so very similar to what was located in the cavernous sinus, but in the cavernous sinus you will also find V2. So the main branches of the ophthalmic division of the 3 terminal branches are the lacrimal nerve, this one here, frontal nerve, and the nasociliary nerve there. Frontal nerve and the lacrimal will come from the superior orbital fissure but will be located outside of the tendinous ring, but only the nasociliary nerve will be located running within the tendinous ring between the superior and inferior divisions of the oculomotor nerve, and also medially located in relation to the abducens. So if we go over these branches, the frontal nerve enters outside the common tendinous ring. It is the largest branch. It goes superior to the levator palpebrae superioris muscle, and it then will split halfway to give the supratrochlear nerve medially, and the supraorbital that goes through the supraorbital notch, or foramen. So that is the supratrochlear nerve and the supraorbital foramen that will be located like at this level. There. What else? So this one is the one that will give sensation to the frontal sinus first of all, and then they come up and give sensation to the skin of the forehead. Then the nasociliary nerve is going through the common tendinous ring. It goes a bit more laterally, and it then crosses the optic nerve to travel along the medial wall and give the terminal branches. So it travels between the medial rectus and the superior oblique muscles, giving the anterior ethmoidal here. It also gives the posterior ethmoidal, and they will go to the nasal cavity, as we saw in the lecture before. So specifically they will supply anterior, middle, and the posterior ethmoidal air cells, and they will go through or pass through anterior and posterior ethmoidal foramen and will open into the nasal cavity. So the anterior ethmoidal nerve goes through a little canal, and this one arrives into the anterior cranial fossa, then into the nasal cavity through the cribriform plate, and finally will terminate as the external nasal nerve supplying the skin of the nose. Now this web of kind of networks of nerves here, so the nasociliary nerve gives a sensory route to the ciliary ganglion. So that is essentially providing a general somatic afferent that can be distributed then with the ciliary nerve. So there is a long ciliary nerve that comes off the nasociliary after it has passed the optic nerve, and the long ciliary will then supply the sclera of the eye, the short ciliary, and the short ciliary nerves that are coming from the ciliary ganglion will be carrying the post-ganglionic parasympathetic to the, or that are coming from the oculomotor nerve. So these are the fibers that are hitchhiking here, parasympathetic, and that will go into the ciliary ganglion to the part of the eye. So these are the short ciliary nerve. That is the one that is carrying the parasympathetic component. Then we have, did I miss one? So then the let me see if it's, well then it will come inferiorly as the infratrochlear nerve supplying the skins of the eyelids, the bridge of the nose, conjunctiva, lacrimal sac, and continue to the anterior and posterior ethmoidal nerves. And the lacrimal nerve, so the lacrimal nerve is one of the smallest branches of the ophthalmic division. This one is located on the lateral side, this one here, and it's traveling superior to the lateral rectus muscle with the lacrimal artery to reach the lacrimal gland. It has sensory afferent that supplies the conjunctiva and the lateral side of the upper eyelid. Here we have a diagram that is explaining which fibers are hitchhiking the lacrimal nerve. So here we have in red the lacrimal nerve and sensory fibers from V1 traveling along there to the lacrimal gland. However, the postganglionic parasympathetic fibers are coming from the facial nerve, and this one will, the facial nerve will reach the lacrimal gland here and travel with the lacrimal nerve. So this is what you can see here in orange. So that is preganglionic fiber, ganglion, postganglionic fiber to the lacrimal gland. And we can see as well these ones that are coming from the sympathetic chain and hitchhiking as well this nerve. Something, yeah, so this is the zygomatic nerve from the maxillary. So this one is kind of complicated, but we will see the zygomatic or the maxillary nerve, sorry, in the next lecture. but I want to stop in here in this diagram. So we have the nasociliary nerve, and in here is given the red are sensory fibers to the eye via the long ciliary nerve, and going through the short ciliary nerve to supply the posterior aspect of the eye. But we also have hitchhiking along the short ciliary nerve, these fibers that are carrying parasympathetic component, and they are coming from the oculomotor nerve. So remember that the preganglionic fibers, so these ones in green, are coming from the Edinger-Westphal nucleus located in the brainstem, and that one belongs to the oculomotor nerve. So the cell bodies will originate there and then come here. This is the parasympathetic route, and will enter into the ciliary ganglion, where we have the cell bodies of the postganglionic neurons that will hitchhike the short ciliary nerves, and that is how we have parasympathetic fibers going there. So yeah, that is all about the branches of this ophthalmic nerve. Now the corneal reflex, this is the last bit. So the corneal reflex is one of the reflexes that will help us to assess the ophthalmic division of the trigeminal nerve. So as we know, the trigeminal is the nerve that provides sensory innervation to the face, to the eyes as well. So in order to assess this reflex, we need to put like a cotton bud and touch the cornea of the patient, so the patient will automatically blink. And how that happens, because the ophthalmic division of the trigeminal is carrying the sensory fibers, so afferent fibers, and they will enter into the brainstem. In here, synapse with an interneuron that will go directly to the motor fibers, or the facial motor nucleus, that has the cell bodies of the lower motor neurons of the facial nerve, and they will go and supply the orbicularis oculi muscle to blink. Yeah, so in summary, these are the main branches of the ophthalmic division of the trigeminal. So we have nasociliary, lacrimal, and frontal nerve. Remember that this nerve is carrying purely sensory fibers. Fibers from the autonomic nervous system, sympathetic and parasympathetic, are hitchhiking this nerve. And yes, that's it. Thank you. Any questions?